Hi, I'm Dr. Jonathan Nisanoff. I'm board certified orthopedic trained. I'm going to be telling you a little bit about how you're going to be recovering after your total hip replacement that you just had. We're going to go over the different aspects of your therapy and what you should be concerned about during the time that you're rehabbing.
Hi, my name is Don Wilbur, and I just had hip surgery. And I know what you're thinking or what you're going through. I understand the pain that you have before surgery, some of the pain that you're going to have after surgery. I can tell you, a year later, actually 3 months later, I was pain-free. My one request from the doctor was, because I am fairly active, that he keeps me in the game. I like to be outdoors, I like to do things. He looked at me and he said, I can do that for you. Here we are today, a little over a year later, and I'm active. I can do all the things that I did before. Playing golf, hiking, backpacking, mountain biking, fly fishing, traveling. I can do things with my knees and my hips now that I couldn't do before. I mean, my hip is, there isn't anything I don't do. I can play golf, I can climb hills, mountains, ride a bike, anything I was doing before. You're going to be wondering, why am I doing this? I can tell you why you're doing it. It's because you will be pain-free and you will have mobility. You will have better mobility than you had in the past. I can tell you one short story about my experience with drugs, the drugs that they gave me from the hospital. I tried to quit cold turkey. I had a reaction. I go back to the doctor and the doctor tells me, no, you can't do that. You need to follow a certain regimen on the drugs. He said, go home, get in a happy place. And a week and a half later, I was not having any reactions. 2 weeks later, I was away from all the drugs. So if there's anything to be said, you want to listen to the doctor and what they tell you as far as how to manage the pain. Now the doctor's going to talk to you about the things that you need to do to make the surgery successful.
After surgery, you're going to be put on some anti-inflammatory and pain medication. The first 2 to 3 days are the worst. And after that, your pain should be getting better and better each day. By day 14, you should be somewhere between 30 to 50% better pain-wise. Your old pain that you had before the procedure should be completely gone. This should just be healing pain from the surgery itself. You should be able to be up and about, walking anywhere from 100 to 400 feet by day 3 to day 5, and probably dancing the jig within 2 weeks. You should expect to have somebody at home for the next couple of weeks helping you with driving, with shopping, with cleaning, with all the other activities of daily living that you would otherwise be doing on your own that you might not be able to do on your own, secondary to a complicated surgery of this nature. If you experience any drainage from the wound site itself, any redness or any kind of pus coming out of the wound site, you would need to contact your physician immediately, as that might be a sign of an infection. Any kind of fevers over the temperature of 100 degrees or any severe pain in the hip that does not go away or continue to get better could be an indication of a complication. You should also limit yourself from tying your shoes or bending down too much, as that might tear some of the healing wound that we are trying to solidify where we did the operation. Some of the medications that you might be put on may cause you some constipation or some gastritis, some stomach ache. If you experience any of that, you should call your physician. They can put you on other medication to counterbalance those side effects. Be limited from doing anything that would require strenuous activity, as we want you to preserve your energy for the healing process for approximately 2 weeks. Certain other things that we would want you to limit is taking a shower for the first 2 to 3 days after surgery, and then submerging yourself in water for up to 2 weeks. By the time the staples or the sutures come out, then you could actually swim and bathe in a bathtub. You should be wearing relatively baggy clothing, clothing that's easy to get in and out of. You can drive after about 3 to 5 days after surgery, as long as somebody is there with you and it's not your driving leg that was operated on. If it was your driving leg, you're going to probably be limited from driving for approximately 2 weeks till you are comfortable enough to actually get in and out of a car. You're going to want to have a car that is much higher up than a lower seated car so that you don't bend too far when getting in and out of that vehicle. There are sometimes readmissions in the hospital, and those readmissions are most commonly from either dislocations or infections that are usually superficial, or a fracture around the prosthesis itself. If you do something that causes your hip to pop out, you will need to be brought by ambulance to the hospital for it to be reset and relocated. That's usually done in the emergency room. Sometimes the patient gets taken to the hospital. No incisions are made. For the most part, the hip is just popped back into place, and that person would need to have a brace for about 6 weeks. But if you follow the rules that are presented to you today, those risks are substantially lower to less than 1%. Your body is going to pretty much tell you when too much is too much. So if you're planning on exercising after this type of surgery, that is fine and it's recommended. But if you start getting winded, or if you find that you're starting to experience some pain, you should limit yourself and let your body kind of tell you how far you're allowed to go. Some tips from my experience have been that when you walk with a walker, if you put a couple of tennis balls on the walker, it'll give you a little bit more traction, and you'll feel the proprioception of the actual ground that you're walking on. You'll be using a walker for the first week or two, and then you'll transition over to hopefully just a cane and eventually nothing. When needing to bend over, if you have the graspers to pick things up from the floor or from a shelf that's up high, that's very helpful. Other tips, if you have family members in the house who are willing to help you, I would definitely use as many people as possible during the first couple of weeks after surgery.
Hi, my name is Michelle Lorero. I'm a physical therapist, and I'm going to tell you a little bit about what you need to know when you come home after a hip replacement surgery. All right, now that you're home after your hip replacement surgery, there's a couple things you want to keep in mind. First off is your hip replacement precautions. There are 3 movements that you may want to make sure that you avoid, because that can put a lot of strain on your new joint. So one is you don't want to flex your hip past 90 degrees. So that means not going up past this angle. And in the same token, you don't want to bend forward, because that's also going to reduce that 90-degree angle. So always no more than 90. Second is you never want to cross your leg past midline. So that leg is never going to cross this way when you're getting in and out of bed, and you don't want to turn your leg inward. So you don't want to rotate the hip, don't cross midline, and don't bring it up past 90. Always make sure hips are neutral. And you don't want to turn your hip inward as well. So the same thing, no inward rotation, no crossing the midline, and no flexing past 90. If we have our right hip newly replaced, we want to protect it when we're going to sit down so we can avoid going past that 90 degrees. So you're going to back yourself up towards the bed so you can feel the surface behind you. You're going to take one hand and reach back for the bed so you know that it's there. Set your right foot out a little bit in front, and then you can slowly lower down, avoiding bending at 90 degrees at your hip. Perfect. Okay, so we've shown you how to sit down properly. Now we're going to have you lay down in bed. So you want to make sure that you're scooched back enough off the edge of the bed, and you can use your hand to help support the leg, but you're going to turn your body as you bring your leg up to try to keep it in that neutral position. Very nice. And then we'll bring that other leg right up. And then you're positioned nicely in bed. To get out of bed, you're going to sit yourself up and you're going to slide your legs to the side, but you want to keep that leg from crossing midline. So keep it right in line as you scoot your body around as you're moving your leg with your body. Good. And just one little section at a time is perfect. Good. You can bring it around. Good. And now you're sitting up. Sometimes at the hospital you'll be given an abduction pillow, and basically it's a pillow that helps keep your legs from crossing midline. If you're not given an abduction pillow, you can just simply use one of your own pillows at home to avoid crossing midline during the nighttime. If you are going to attempt to sleep on your side, you need to keep a pillow between your knees, again, to avoid internally rotating and crossing midline. So if you're going to come onto your side, we're going to keep the pillow between your knees. And we'll place this right between to keep the hips in a more neutral position. If you keep these precautions in mind and try to support the hip with pillows, you should have the most decent night's sleep you can get, minus the pain of your hip. But this is going to put your hip in the best position possible to avoid straining. There's some great exercises you can do to maintain the mobility of the hip and to start introducing strength exercises as well. One of the easiest exercises you can do for circulation of the leg is ankle pumps. So you're going to just point and flex your foot up and down. Good. And with all of these exercises, a good rule of thumb is to do about 10 repetitions, doing it about 10 times, and then building your way up to maybe 2 to 3 sets throughout the day. Okay. The next exercise we can do is to help with knee and hip flexibility. So you're going to imagine sliding your heel towards your bottom. So you're just going to bend the knee while the heel slides on the bed, and then you're going to straighten it right back out, sliding that heel right back down to a straightened leg. Good. Bring it on up and back down. Good. Flexing both the hip and the knee and straightening them back down. Another important muscle that you can strengthen while you're in bed is your glute muscles, and they're very important for standing, walking, for balance. So you're going to squeeze the glutes, like just squeeze your buns close together, squeeze, hold for a couple seconds, and then release. Good. And squeeze and release. This is strengthening the muscles in the posterior part of your hip. One of the precautions we had was to not go midline. So you would never slide your leg inward. But one of the things we need to do is slide our leg to the outside to strengthen our outer hip muscles called the abductors. So you can slide that heel out to the side and then slide right back to that midline. If you're not sure where your midline is, you can start with our pillow idea again and keep that hip at a good starting position so you know where to return to. So you can slide that leg out to the side. We're working that outside hip muscle and slide it back in. Good. And then back out and back in.
And this one I should take as far as my body will allow?
About maybe just 45 degrees out and in is plenty. One other muscle we can work on is the quadricep muscle. And what you want to do is imagine you've got my hand underneath your knee, and you're going to tighten that quad muscle, pushing your knee down into my hand. So you're squeezing that muscle nice and tight, hold, and then relax. Push and squeeze down and relax. Good. And tighten that thigh muscle and relax. If you incorporate these exercises into your daily routine during your recovery, you're going to find yourself healing faster and getting yourself back to your normal daily functions a lot sooner. In our demonstration, we did our exercises on the left leg. When you are at home, you want to do your exercises on the leg that had the hip replacement. When you get home from the hospital, you want to take a look around your house and see if there's any objects or obstacles that might get in your way of how you maneuver through your home. These items may be throw rugs, small appliances, pieces of furniture. Just take a look around and make sure that your pathway is clear so you can get through easily with your walker.
If you need any additional information, here are several resources and websites that you're able to contact that might be useful for your post-operative needs.